Thank you. Thank you for your patience, everyone. Good afternoon. My name is Sapna Kedia, and I work at the International Center for Research on Women. Thank you for joining this webinar with us. Today, we'll be talking about how do you work with the government, how do you work with state systems using evidence and research. And the reason why we thought we'll do this webinar is because within ICRW, we do a lot of work with the government. We conduct research, we use evidence to run our programs in partnership with the government. And because we are celebrating this Eval Week with Global, we thought it would be good to bring in this perspective of working with the government using data and evidence. With us today, we have panelists from the ICRW team and from our partner teams from the Quantum Hub, as well as the Budget Research and Analysis Center in Jaipur. So today, the way that today's next one and a half hour is organized is we'll begin with some introductory remarks from Dr. Ravi Verma, who's our director who leads our research program and evidence work here at ICRW. He'll be talking and setting the context in terms of our work using research and evidence. And we'll also be talking about some of the methods we use and some of the challenges and our learnings, basically, of working with the state governments and with governments around some of these issues. And the one thing that I forgot to mention is that we are looking at not just working with state governments in research and evidence, but working with them to promote equity and inclusion. That's very important. The evidence that we use, the programs that we run with governments, the ultimate goal or outcome that we hope to achieve is to make government work, to make programs more equitable and inclusive. So Dr. Ravi Verma will be touching upon some of that. And then we'll move on to a panel discussion. I will now hand over to Dr. Ravi Verma to please give us his introductory remarks and set the context. Thank you, Ravi. Over to you.
Thank you, Sapna. And thanks to all our partners who have agreed to join us in this important dialogue, both Nesar and Sneha. I think this is an important discussion for many of us who are engaged on evidence as a platform to influence the policies or to influence the programs through larger systems like government. And it's very interesting because, in my view, there are a couple of features of these interactions. For someone who is outside the government system and works with the larger government system to say that, okay, we have an evidence, let's work towards equity. And government knows its responsibilities, and government does have its own data system. So what is it that we do as researchers? What is our value addition to what government already has or does not have is very critical for us who are sitting on the, if I can use the term, other side of the table. Although all of us believe in a continuum of partnership in development sector, but the fact is that the largest chunk of development is owned by the government, and they are the ones who are delivering the development on the ground. Lots of us in the civil society and outside government systems we are more like sounding boards or becoming the links to the last person on the mile where the government system is not reaching in some ways. So part of the responsibility of equity rests on us, in fact. When you work with the government, the expectation is that you work within the civil society, so help us to reach to the last person on the mile. And then how does one really hold oneself accountable, the larger system accountable, that yes, last person on the mile is reached, within the framework of equity. And that's where evidence and data that we bring in, or when we work with the government, becomes very critical. And it's not only, okay, that becomes critical, but I think what is important is that we need to, when in these kind of work that I have been engaged with in several programs with the government, is to really break our paradigm of understanding data. What constitutes data? That's the first piece that I have always questioned, that there are and have tried to represent the data in whichever way we understand to the government system, which should be palatable and which would make sense to every stakeholder. So there are two aspects of data, in fact, in my view. One is the measurable, observable aspects of data. And then there is the entire domain of unobservables of data. Quantitatively, what we measure as part of the progress of a program, or if you do a situation analysis and we get certain point prevalence of certain information, that's just the quantitative 1 point. But then when we begin to make sure that this gets into the system, then it is the unobservable part of data that becomes far more important. And how do we bring in those aspects on the table, both in the initial stages and during the course of implementation and during the later part, is very critical. It's extremely critical that we go beyond data to talk about data. And and I'm saying it with all seriousness, because very often, give me a minute, I'll just get the water. So it becomes very, it's very critical that we say data, and yet we talk about those aspects of data that have not been measured, or they need to be measured, or they need to be represented as something that is unfolding as part of the process. So this is one point I think I really hope that panelists would reflect on this. The other piece is that, in my view, data is to be seen as a continuum. It's just not, it's all about unfolding process of learning in programs that we work with the government. So every turn of event, every turn of program, there's some learning that is emerging, which may not be captured in your formal database, but they are important. And I'm not talking about only the qualitative, formal qualitative data that comes, but a deep immersion into the program tells you that there are some learning that would require to be looped back into the program. And that should be part of the conversation on a regular basis with the government. And the third piece is that there are a whole lot of data within the government system that is often not used. Like budget, and we know Nesar and colleagues have been working so closely that there's a whole lot of MIS kind of a database within the government system that are not effectively used to design the program or monitor the program, even though government knows, and government is so appreciative of that. So government also appreciates if we go and say that we will work together and use this existing database to help shape the programs. So I'm talking about three things. One, we must assure the government system that we will not only be discussing the observables, but a lot of unobservable part of data. And that will be on a continuous basis, because it is a learning that is emerging through the program and needs to be shared, so that we must assure that we are using all that as a piece of evidence. And two, that we in our system should be prepared to take that kind of a deep dive into our own learning process. Our own learning process, many times as implementers, we get lost so much that we don't really look at what the learnings are emerging. This is what I said as a second point of mine, as a continuum of learning, and that may not fit into the formal structure of data, but that's so critical. And the third piece is, any potential that data that government has MIS by way of MIS or by way of the routine data system that can be on a regular basis used and plowed back into the program and becomes part of the conversation, then you emerge as a credible player, as a credible stakeholder, because it's not about us or them, but it's about using all the opportunities that exist to complete the jigsaw puzzle of the larger story. And I think I've done my 5 minutes. I think Sapna forgot to say that I only have 5 minutes. This is not my panel. I'm not part of the formal panel, but I just wanted to share my thoughts about data and how I have experienced in making many of these programs as an insight, as a program adopted by the government, implemented by the government in a co-ownership process where mutual respect for each other's data value additions are done on a regular basis. So if it makes sense, then I'll stop here and pass on the baton to my colleagues in the panel. Is that okay, Sapna?
Thank you, Ravi. Thank you for setting the context, and I think reminding us, as always, to read in between the lines. I think in research and in evidence, very often there is a risk that we go in for the obvious. And I think it's important, like you said, about, you must think about evidence as something that is not always very visible. So thank you for starting the webinar on that note. That is very, very important point. And also what you said about how the government appreciates if you come and if you tell them that you want to work with them, you want to generate evidence. There is often cynicism around working with the government's response and acceptance of data, of the evidence that you bring to the table. So thank you for reminding us that sometimes the government is also appreciative. And most of the times, yes. So thank you, Ravi, for setting the context so beautifully. We'll now move on to our panel discussion. I would request all the panelists to please switch on their cameras. Yeah, thank you, Nesar. I'll begin with a short introduction of all our panelists, and then we'll begin the panel discussion. I'm very glad to welcome Nesar Ahmad. Nesar is from the Budget Research and Analysis Center in Jaipur. They do a lot of work with government budgets. They look at policies and they try to find out where there are entry points. And Nesar and his team have worked closely with ICRW on our Gems for Boys program in Rajasthan. I'm very glad to also welcome Sneha Pillai, who's from the Quantum Hub. Sneha is the research manager and communication and advocacy lead at the Quantum Hub, and she's been supporting ICRW's work on COVID and related policy implications. Welcome, Sneha, to the panel. And then I'll go to my colleagues from ICRW. I'm very glad to welcome Dalia Sebastian, who's been leading a lot of our work on research and evaluation, and she's been supporting a lot of the evaluation monitoring work in most of our programs, and very recently the Gems for Boys program in Rajasthan. Welcome to the panel, Dalia. I'd like to now welcome Aditi. Aditi has been supporting a lot of ICRW work on adolescent girls, empowerment and employability. Aditi is also currently working on the Life Skill Collaborative project at ICRW, which she's talking about in a minute. Welcome to the panel, Aditi. And finally, we have with us Sneha Sharma, who was with ICRW until last week. She was been working with ICRW for the last 4 years, and she's supported a lot of our work on non-traditional livelihoods. She's also supported our programs on adolescent girls empowerment, and very recently looking at informal workers and the impact of COVID on their livelihoods. Sneha has just recently moved on to the World Informal Workers Network, and we are so glad that she joined us for this panel. Welcome to the panel, Sneha. So, without any further delay, I think just to start off our panel discussion, it would be good to understand the work that each one of you is doing with the government. How are you engaging with the government, especially in terms of using research and evidence? And like it's my duty as a moderator, please, each speaker would have 3 minutes to respond to this question. So, Nisar, if you don't mind, can we begin with you in terms of how your center is working with the government using research and evidence?
Yeah, thank you, Sapna, for giving us this opportunity. So, BARC has been working with government for last 15, 17 years. We try to engage with government, as the name suggests, we focus on budget as well as many other policy issues and policy and programs of the government. So we kind of follow the we engage with the government before the budget, and the budget is actually being prepared, when the pre-budget consultations are happening by the government. And we also organize some pre-budget consultations where we collect the views of the people, where we collect the aspirations of the people or their wishes from the government, their expectations from the coming budget, and we share it with the government. As well as at this stage, we also to some extent with the legislators, the MLAs elected, and we share with these findings, and we take their views, and we make care of the previous year's budgetary announcements, the trends in the budget data, numbers, etc., on various schemes and programs, so that they are in a way well prepared before when the budget session actually is happening in the state. And we share our, as I said, demand suggestions which we collect from the pre-budget consultations with the government, in the government pre-budget consultation, in writing, in whatever ways we can do. Then when the budget session starts, we talk to a few elected representatives, the legislators who are interested in raising these issues, and we kind of inform them of our analysis, our findings, our issues. So this is one post perspective, our lenses which we use, like.
Sorry, Nisar, your voice is not very clear. Maybe I think you'll have to switch off your video.
I'm sorry. So, so I was saying that we analyze the budget from the perspective of the marginalized people, poor people, women, children, and then we put it in public domain. With media, we share it with the.
Sorry, Nisar.
I'm in Delhi still. I don't know what is happening. I'm not in. I was saying that we put our analysis of the budget from various perspectives, mainly in public domain, but mainly we share it with media and civil society organizations, as well as again the elected representatives. And then after that, when it is time of implementation of the announcements and the new programs and projects which have been announced in the budget, then we try to some of them with the help of the civil society organizations. So a budget center, a small budget center with 5-6 people is not going to obviously be everywhere. So we try to collaborate with the civil society organizations, the people's organizations on the ground, working with, say, homeless people, working with Dalit and tribal people, working with nomadic people, working with women and children. So we work through them, with them, we feed them, we learn from them what are the issues on which they want data and information, and what are the issues on the ground which needs to be raised, which needs to be looked into in the government documents, policy and budget documents. Last thing, I know I'm running out of time. Last thing is also asking the government to provide new data, more data, and coming out with new budget documents. So how transparent the budgetary process is in the state compared to, say, other states of the country, or compared to the international standards, that is also we have been trying to measure and inform the government, and we can say that we have seen some results as the government has provided new documents, new statements. For example, now government of Rajasthan is, apart from gender and child budget statement, they are also bringing out SDG statement, a statement on what all the expenditure is going towards achievement of SDGs. Tribal sub-plan, scheduled caste plan, is one of the issues we have raised continuously, and now ultimately this year the government has passed an act to back this scheme with a law. So these are some of the things which we have been doing. Thank you. So I hope I'm not taking time.
No, thank you so much, Nesar, for highlighting how you use budget as a tool to generate evidence, as a tool for accountability, as a tool for making the government responsive to people's needs. So I think it was a very good description of the whole cycle, pre and post budget. So thank you so much for that. I'd like to now move on to Aditi. Aditi, could you share a little bit with us about your work with the government and how you're engaging the government?
Sure. Thank you, Sapna. Thanks, everybody. Welcome, everyone, to this webinar. I'm so glad everybody could make time. So very quickly, ICRW has been working with the Life Skills Collaborative. It is a collaborative of 18 organizations that have come together with the aim of building an enabling environment in the country for the uptake and embedment of life skills education within the public education system. So for this, ICRW brings in the partnership with the government with assessment expertise. And the idea really is to be able to develop tools, evidence-based assessment tools that can enable the state education system to assess their own preparedness, readiness, willingness to uptake life skills education as part of the education system and really embed it within the system. So for this, we are doing two things. We are developing self-assessment tools for teachers, because teachers, as we all know, are a very critical part of the education system. And we are developing assessment tools, which will be developed in the form of a self-assessment scorecard that will enable the state education system to, again, assess their own preparedness for uptake of life skills education. You can read a little bit more about the Life Skills Collaborative on the website. We will share the link currently. And within that, how this entire process is being sort of charted out in terms of development of these very two critical pieces of assessment tools. The idea being that they will be available eventually in the public domain, and they will be available for other governments to also uptake and use and assess their own preparedness for life skills education in the state. Right now, we're working in 4 states of Maharashtra, Mizoram, Uttarakhand, and Rajasthan. And I will delve into more in terms of the methodology and what we are doing and how we are doing it with the government, how we are using data, where are the inputs from the government. Like Ravi mentioned that, there is already so much data at the government platforms, but one is not able to really use it. So how we are doing all of that, I will talk about in the next section. Sapna, I hope I'm within time.
Thank you. Thanks, Aditi. You're very much in time. So that's very interesting. I think it sort of builds up on what Nesar mentioned. Nesar spoke about budgets. You are talking about in a way of looking at system, within the system processes and opportunities within the system to promote life skills education and how the system can better prepare itself. So thank you, Aditi. We look forward to hearing more on the collaborative and its work. I would now like to move on to Sneha Pillai. Sneha, if you could, we have two Snehas on our panel, and hence that's why I'm taking both their surnames. Sneha, if you'd like to just take us through Quantum Hub's work with the government and also your partnership with ICRW.
Yeah, thank you so much, Sapna. So yeah, actually, before I get into the question, maybe I can give like a brief context about the organization that I work for, the Quantum Hub. So essentially, we are a policy research and communications firm, and we work with different types of organization, which includes private tech companies, it includes government departments, multilaterals, and also social impact investment firms, and of course, research organizations like ICRW. And what we do is we work across the policy life cycle on a spectrum of policy issues. And so there are different ways in which we engage with the government. And there are different times which calls for like strategic approaches. But I guess if I had to broadly describe our engagement with the government, I'd say that there are two different ways in which we engage. The first kind is, of course, when we hear about a particular state government or a ministry being interested in a new policy issue or in redesigning an existing one. So for instance, when we had heard that the Tamil Nadu government was considering an urban employment scheme, we thought that was also very, important for improving female labor force participation. So with that objective in mind, we actually put together a policy brief which highlighted the importance of a gender lens in designing such a scheme. And here I would also like to attest to a point that Dr. Verma was making about how, governments are actually super keen on hearing from the research or like from, other people in the policy ecosystem and getting the evidence for whatever helps in making the policy design strong. And so we had like multiple consultations with the government, and we were really happy to see that some of our recommendations on gender responsiveness actually made it to the final scheme design. And similarly, we have engaged with different state governments on different policy schemes. The other type of work, and something which is also very pertinent to what we are talking about today, is the work that we do on basically analyzing the policy landscape. So that's also the work that we had done for ICRW, which is where we basically did a mapping of the policy landscape and made a comprehensive list of all the COVID relief schemes that were announced, both at the central level and at the state level in the NCR region. So by the state governments of Delhi, Rajasthan, Haryana, UP. And we went a step further to also assess the gendered impact that these policies had on the urban informal workers in NCR. We have also done another exercise along like similar lines, wherein we had done a policy mapping of schemes that are pertaining to women's economic empowerment. This I feel like is a very important tool for engagement with the government, because again, like attesting to another point that Dr. Verma was making about how evidence can loop back into, help us learn about the help better the program. And also, while the government systems themselves have like a lot of data, what they, providing them with some additional data along these lines on how the policy design has fared, what can work better or what has worked better, can also help design similar programs and help in monitoring those policy designs and let the government know if there is a need to like redesign the policy to serve its intended purposes, then here's the evidence on how you could do that. So yeah, that's how we engage with the government, and looking forward to talking more about our work with ICRW and also like similar work that we have done along these lines.
Thank you, Sneha. We're very interested to hear about the employment scheme in Tamil Nadu and how your policy brief was taken and how the government responded. I think that's very, very valid in terms of making government schemes more gender sensitive, more responsive to the realities of women and girls. Over to you, Dalia, to talk about our work in Rajasthan with the government.
Thank you, Sapna. And it was really nice to hear from other panelists about their exciting work. So I'll be more talking about the engagement with the government in our program Gems for Boys, which was like addressing the issue of gender and masculinities with adolescent boys in school settings. So if I talk about, it's more of not an engagement, probably it's a collaborative effort from the government system as well as the ICRW at various levels, starting from the school to the state level engagement. And the program has started this collaboration from the very beginning of phase of the implementation. So we have an MOU with the government of Rajasthan, engaging different entities of education department, including SCRT for curriculum development, using, sharing the formative research findings. So this all help created an ownership within the system. And again, when it's also important to understand, when we work on a program which addresses the gender transformative approach, it's equally important what Ravi was telling in the introductory discussion. It's equally important to share the processes and sometimes the invisible part of how we reach to the outcome and outputs of the program. So we engage. So here it's more than if I'll tell, rather than sharing the evidences, we engage the system also a part of gathering the information and using that data, like the school teachers, the government school teachers as part of the system. They were the leaders of this program implementation. And when we are and the continuous discussion with the block level, district level, and state level officials, and we use the data, we also try to link it with the personal experiences of different stakeholders who are part of the program. So that really helps the officials to reflect internally and also look at the evidences more intensively. So when we talk about the issues which probably might have threatened them, like for example, we talk about the power dynamics and how the power can be used negatively in a school setting where the teachers will be talking about the students. In many of the cases, they themselves might have used it, and then reflecting it and moving forward. That really helps. And I think when we share it even with the state level officials, so looking at the data and explaining it, linking it with how the transformation happened in the personal experience, that actually creates more interest, and they also look at more detail in the data and the evidences we are bringing forward. So I think I'll stop here.
Thank you, Dalia. It's very interesting how you spoke about the involvement of school teachers and how they are using program data to implement the program better. I think that's very important, and we'll come back to that. I will now hand over to our last panelist, Sneha. Sneha, over to you to speak about our work on COVID and also our work on informal workers.
Thank you, Sapna. And it's been great listening to all other panelists and some of the things that I also resonate from our experience. So today, I am going to talk about two projects that had a very major mandate of working with the systems, but in a very distinct manner. So one being the sex, gender, and COVID-19 project that was aimed at tracking the sex differences for COVID-19 clinical outcomes for men and women. So to be able to do this with the help of our partners, Global Health 50/50 and African Population Health Research Center, we built a COVID tracker, which is now the world's largest sex disaggregated COVID tracker. So we use data from government dashboards, press releases, or even the situational reports that they were submitting to the World Health Organization, WHO. And we collected data from there on certain parameters, and especially looked at data that was sex disaggregated, say sex disaggregated death data, sex disaggregated case data. So since we were relying a lot on the government released data, we had a very direct engagement with the data surveillance system set up by the governments around the health reporting. So that was a very direct engagement that we had there. The other project, which is again based in the COVID context. That is called the Rebuild Project for informal workers in India, Kenya, and Uganda. Though I'll be talking about my experience from the India part of the project. So for the other project, we were looking at getting voices from informal workers, getting their voices feed into the policy systems and the policy networks or with the local officials. So a very indirect sort of an engagement, because we were heavily relying on the voices and the needs of these women workers, and how can we use that to be able to fill into the policy networks, or the policy networks or other kind of local engagement efforts that are going on. So these are the two separate projects. And for Rebuild, we were looking at primary research, a policy landscaping that Sneha, my fellow panelist, spoke about in her own. So that were two things that we are looking at for Rebuild. So these are two very distinct projects that I'll be able to reflect on today. And of course, I'll once we move on to the panel, and once we move on in the questions, I'll be talking more about in details about these two projects and our work within that.
Thank you so much, Sneha. So we've spoken about many different ways of engaging with the government. We're looking at budgets, we're looking at government schemes, we're looking at collecting data on experiences of people and then taking it to the government. Then we're also talking about looking at the system within the government and how various verticals within the government are organized, and there how can we sort of include programs and make programs more contextual. So different kinds of ways of engaging with the government, using evidence to work with the government. This takes me to my second question, and Nesar, I'd like to come back to you. And could you be a little bit more specific and tell us about the specific methods that you use to sort of look at budgets and some of the activities that you just described? What are some of the specific methods that you and your team use, Nesar?
Yeah, so I'll start with this example of tribal subplan and scheduled caste subplan. Scheduled caste subplan, which earlier was used to be known as special component plan. Am I audible?
Yes, you are.
So the government, the government would provide a statement with its budget document, one page, very short statement saying that actually the addition to these two subplans being done up to the norm, or more or less closer to the norm, which should be in case of Rajasthan 17% for 16 to 17% for SCSP and 12-13% for TS. Then we went ahead further and we started looking into the
Sorry, Nesar, we can't hear you. Hello? Can everyone else hear Nesar?
I'm back. So we started looking into the detailed demands for grants and actually calculating the total allocations as per the minor heads, assigned for these two sub-plans by the CAG. So according to that, we were able to show that actually the allocations are abysmal, very low, 2 to 3 to 4% initially. And then when it became a kind of a big issue by the media picked it up, the MLAs picked it up, and they raised it at their level. And then the government started improving on it. So it will vary, in different cases you have to have different methods. So in this case, because it was budget, so we looked into detailed demands for grants, and we learned about the budgets. We learned about all the heads, major head, minor head, sub major head, and those things, and we get into that much of detail. So my point is it varies from one to other. In case of, say, for example, gender issues, we have been saying about the things which Ravi said earlier about, the non-visible, invisible things, invisible data, which we have to highlight. So we said that the gender budget statement of the government has, Rajasthan government has problems, but so it should improve on that, but it should go beyond that, and it should get into those invisible things which women have to face at workplace, when they are looking for work, when they are in the school, and everything. And it seems that government has now kind of started. So government took many years even to appoint these officers under this Domestic Violence Act. You have to have this protection, these officials. I'm forgetting the name of that post. It took years, about a decade, even after women organizations have been demanding of it. But now it seems the government is showing some positive signs of looking into those invisible things. For example, this year the government launched a program for women who have somehow have gone out of the workforce, and if they want to come back to workforce, there is a program for them. So these are some of the invisible things which should be could be highlighted and said. So, I mean, the sensitivity in case of, say, healthcare, the people, homeless people, when they go to hospital, how they are treated, the brick kiln workers who have come from other states to the state of Rajasthan, how they are treated when they go to a government health center, and why they necessarily have an identity card which must prove that they are from Rajasthan if they want to access certain schemes and programs. So all the states of the country attract many migrant workers. So how will, if all the states start limiting their schemes and programs only to the people having a certain card, apart from Aadhaar card, one more card is required in Rajasthan, that is called Janadhar, that is again biometric, and this is not happening only in Rajasthan. So these things are to be raised. These things are, to my mind, coming to this invisible domain which Ravi was mentioning, have to be told, have to be raised with the government in each and every meeting, so that they remember it, that yeah, you had said it last time also, you are saying it again, and so that it at some point of time it gets into the policy changes or in the redesigning of the programs. So this is how these so methods for us one is technical type, understanding the budget structure, etc. Other is constantly being in touch with these groups on the ground. So there you learn a lot. There you understand what to raise, how to raise, what issues to say, and being with them. Not necessarily that you are the one who is going to the government. You go with them, be with them, remain with them. That is more important for a research organization which is based in, say, a place like Jaipur. So you have to work very closely with these organizations.
Thank you. Thank you. Yeah. Thank you, Nesar. Thank you for explaining it very clearly, that you do it twofold. You look at the budget, the technical aspects of it, you analyze that, and at the same time you look at how it has implications on the lives of different people who are accessing these schemes, and how it actually translates onto the ground, and then you take that feedback back to the government. So in a way, it's cyclical. Thank you for explaining that. Dalia, over to you to speak a little bit about some of the methods that we are using to engage with the government in Rajasthan.
Thank you, Sapna. So for the GEMS program, we use multiple platforms to generate the evidence and engage it with the government officials. So if I'll talk about starting from the formative research to contextualize the issue and build the curriculum which we are going to implement it. It needs to be very well knitted in the local context. So we started with a formative research, and once the program has taken off in the ground. So the online monitoring system, which captures the reach and the quality of the program intervention at the school. So like I said, lot of stakeholders, including the government, teachers were part of sharing or feeding the data. And this helps also to feedback not only to the government officials or like how the program is moving. So it also reflects to ourselves the data which is gathered using like observation, as well as like looking at the questions which the students were asked, and the feedback from the students. That's also more important to critically look ourselves also to like what more are required and how we need to like alter or change whatever changes are required to the program implementation. And even giving the access to the different level government officials on the dashboard, that also helps. So if I'll just try to link it, how these methods which we use to generate the evidence and then engaging it with the government, how it helped us was providing access to the dashboards to the government official to see some of the critical indicators of the program really helps them also to see how the program is progressing and what important aspects and the changes which is happening within the system itself. So the level of comfort of the teachers, how it moved to discuss on a critical issue of masculinity and gender-based violence with adolescent boys in a school setting. If they will look at the MIS data over one period to another, really helps how the teachers are taking the ownership, how the participation of the students like improved in the sessions. And also like we have conducted some small level like research component which is also inbuilt in the monitoring of the program, the larger monitoring of the program. We followed up with a cohort of boys over 2 points of time to understand like how their perceptions or attitudes are changing when they exposed to the program. So it's rather than just capturing them at the baseline or the end line as an evaluation, it's also important for us to look at how the process of change when it is happening and when they have a level of exposure to the program and how they are like the journey, how it changes. Also, we interacted with the teachers, our program staff's continuous engagement, plus a systematic engagement of teachers through in-depth interviews. That also captures like the journey within themselves to the program period, and how it's not only reflect on their professional sphere, but it also like internally reflecting on this issue themselves and personalizing it and how they used it in their personal sphere as well. And the documentation part, that is really important when, especially when the teachers training happen, the extensive documentation also help us with linking it up with their pre and post assessment, and the documentation really helps how the journey of transformation again. And the budget analysis which we have done with the BARC, which Nesar was talking in his discussion, that also provides an opportunity when we interact with government and share the evidences with government to say, like, you know, we have enough budget available and these are some of the available resources which are dedicated to the adolescent program. So we didn't only limit the budget analysis with education department, we also look at the programs of health, youth and development and sports, where we can leverage the existing budget for adolescent programs like this, whether it is with the health department or with the education department. These are some of the platforms which we have used to generate the data and link it with the government system.
Thank you. Thanks, Dalia. So you spoke about two very important strategies. One is looking for opportunities within the government to run programs on gender, to see how these programs can be institutionalized within the government by looking at budget provisions, by looking at different schemes, policies that the government has. And the other very interesting thing that you spoke about is when you run programs like this in the government, like the GEMS for Boys program in Rajasthan, gender equality movement in schools, how you create a sense of ownership within the government by sharing the program data with them, by getting feedback with them as the program is running. Right? Thank you. Thanks, Dalia. I'll now move on to Sneha Sharma. Sneha, could you take us through some of our methods to do the COVID work and also the informal workers work, please?
Sure, Sapna. In terms of the methods, and I'll be speaking about the COVID tracker first. So in terms of the methods, because we were collecting data from different releases by the government of different countries, and we are covering around 180 to 190 countries at this point of time in the tracker. So while we were looking at data, so we needed some sort of standardized templates to be able to, because every country releases data in a very different manner. So having those standardized templates to be able to collect those data, and of course, contextualizing it based on the requirements of different countries. So I think we did that. And using because data was extremely important for us, and in terms of data, when we are saying it is, not just the numbers of it, but what do those numbers represent. So using that data, we have been engaging with the governments at a very regular in a very regular manner in forms of either press releases, monthly reports, or even direct emails and a closed roundtable with a lot of stakeholders and data surveillance teams. So we have been doing that over the period of last 1.5 years. And using these spaces to be able to really showcase how does this data reflect the contextual factors of why there are differences between men and women seeking certain health services around COVID, or why is the data for men and women looking different. So we are using data to drive a lot of these decisions. And this data also reveals a lot of these essential insights into the inequities that are existing in these countries. For every country, the COVID situation might not look very similar. So there are very, very distinct differences between, say, country in a Western, in a Western context compared to an Eastern context. So why are these differences also existing? So just using data to be able to showcase that, and this kind of differences might not have been visible otherwise if we didn't have data. So using the data, we have also been able to showcase, how the population that is at more risk of death from COVID-19, how can we have better policies for them? And when I'm talking about data, it is not just limited to, just the numbers of it, but also we have developed a policy portal that looked at health policies that came around COVID from different countries and assessed them on a gender responsive scale. So using all of this, we have been able to engage very directly with the government systems and have been able to establish a need for having gender, sex disaggregated data, and understanding the role that gender would play in health seeking outcomes, or even in a pandemic situation that a lot of these countries face. So this was in terms of the methods for the COVID tracker. Now moving on to the informal work that we are doing. And as I said, that the informal work is more ground up in the sense that we are engaging with women workers directly, women workers in Delhi and the National Capital Region in India. So we are using workshops and in-depth interviews, surveys, and analyzing this, the data that we are getting from them, including doing a policy landscaping exercise or doing a case studies on different occupations that exist, and compiling all of the findings from this kind of a very extensive primary research and a secondary research. we are using this data to engage with grassroots level organizations that are partners, or even if they are not our partners, grassroots level organizations that are working directly with women workers, and helping them use this data in their advocacy efforts with local systems that could include municipal corporations or local level leaders, or since informal occupation includes street vendors, so including that with their vending committees that exist in different markets, how can they use our findings to be able to engage with this level of system. So it has helped that since a lot of these organizations that are working closely, that are grassroots based, are working closely with women workers, and their efforts are localized, and using our findings, they have had a because their advocacy efforts are very localized and they have a direct impact on women workers. So using our findings, we have been able to create create a very strong advocacy system within that. This work is currently ongoing, so we are still hoping that will be able to strengthen our national and global policy advocacy efforts. And since this project is also based in other countries, which is Kenya and Uganda, we are looking at having more global policy level consultations with networks and with very large organizations that are working with informal workers, and we hope that we are able to feed our findings into their advocacy agenda. At the same time, we are also engaging with trade unions, and being able to and trying to fit in our findings within their work. So since all of these efforts are currently ongoing, we'll have more to share about it in some further months. But at this point of time, we have been able to create a very good network with our grassroots organizations.
Thank you, Sneha. I'd now like to move on to Sneha Pillai, and she can build on a little bit of what Sneha said and shared. Over to you, Sneha.
Thank you so much, Sapna, and thanks, Sneha, for setting the context in some of the COVID work that ICRW has done. So just to reiterate, like even TQH was working very closely on that, the work where we did the policy landscaping study with ICRW. So I'll just focus on that, and I'm also cognizant of time, so I'll try to keep my answer brief. Basically, for this particular study, the objective was to assess the state's response during COVID-19, and to also understand what was the gendered impact on urban informal workers. So essentially, there were two broad parts to this study. One was, of course, doing the policy landscaping, and the second was then studying the effectiveness of this, the state's response. So for the policy landscaping study, in terms of the methodology that we used for data collection, it was pretty straightforward. We went through all these government websites, the central level, the centers websites, different department websites, and also the state government websites to see what were the schemes announced. We also went a step further to look at media reports, because a lot of schemes, especially during COVID, were also being announced through media articles and newspaper articles and press releases. But of course, we realized that this would also then warrant a truthing exercise where we are looking at, how many of these schemes actually just ended up, not going beyond media announcements. And wherever we found that there were a few such instances where that did happen, some schemes were announced in the media, but we couldn't find any corresponding government order or a notification to say that it had been officially announced as well. So in those cases, we took those schemes out from our assessment. And then we had our key informant interviews, which were also a significant part of our methodology. We also asked them, because some of them were also activists, people who had been at the ground level, who had been speaking to the, target audience that we had been looking for in this study. So they were also able to supplement our findings by saying that these schemes were effective. There were such schemes that the state had rolled out. There were a few schemes which were also missed out, which we could then add basis what we heard back from the key informants. So that was one part of the study on the policy landscape. Then to study the effectiveness of them, what we did is, again, budget is a good indicator in that sense to understand how important a particular scheme is for the government, right? So we looked at budget announcements, allocations. We also looked at wherever MIS data was available, mostly only in the case of the central schemes, those were available. So we then looked at beneficiary data. And thirdly, reiterating some of the points that some of my other panelists have also made, data only goes so far in presenting a story. Like, it doesn't really paint like an accurate picture. To understand or to contextualize data, what we did is we also supplemented that with key informant interviews who helped us really situate the data in terms of what was actually happening on the ground. So yeah, that was essentially the process that we followed for data collection. And third, just to even basically come up with an objective way in which we could assess the effectiveness of the scheme, we had essentially developed a framework which was adapted from a report by the National Collaborating Center on Public Policy in Canada. Through this framework, we came up with a few metrics using which we thought we should be assessing the schemes. And the metrics were effectiveness, unintended effects, which was very key actually in a lot of the schemes that were announced by the states, equity, cost, feasibility, acceptability, and one other metric that we had added was to look at the presence of informal or alternative mechanisms, because in a lot of places wherever there were gaps in the government welfare outreach, it was actually being filled by civil society organizations or by informal networks in that sense. So that's the methodology that we had used for this study. And Sapna, I hope I haven't taken too much time.
Thank you. No, thank you. Thank you so much, Sneha. Aditi, over to you to talk a little bit about how the methods that you're using in the life skills collaborative.
Sure. Thank you, Sapna. Thank you, everybody. It's been wonderful to listen to everybody. And I feel like the common theme that we've been talking about is, how does the data really feed back to the government? How do we really work with the system from the very beginning? So in LSC, we are really following this process very diligently. So government is not only a critical stakeholder, it is also an equal collaborator. So when we say that we want to develop evidence-based assessment tools that can be embedded within the education system to assess life skill preparedness, what do we really mean? How do we develop these tools? So for the systems assessment tool, the way we went about it was really looking at all the literature, and there's a lot of literature on the relevance, importance, criticality of life skills education, 21st century skills, including thematic areas of entrepreneurship, mental health and well-being. The NEP 2020 talks extensively about it in terms of the policies as well. So the literature review threw up a lot of insights, but we could not find a single tool in the public domain that actually assesses education systems preparedness to take up life skills education and integrate it within the overall public education system. So for this, we conducted a formative research study with critical stakeholders from the education system. This meant conducting KIIs with the state level officials from different departments, whether it is CMAT, whether it is Samsat, Samagra Shiksha Abhiyan, which is in different, called by different names in different states, whether it is the Directorate of Education. We also spoke to officials at the district and block level. We spoke to teachers, we spoke to heads of schools, and we also spoke to a few critical other stakeholders like other NGOs that are working on life skills in the state. So based on this formative research with government stakeholders in the education system, we developed a self-assessment scorecard. What does the scorecard look like? The scorecard is essentially a self-assessment tool for the education system to be able to assess its preparedness vis-a-vis life skills education implementation at various levels. So some of the thematic areas that came up were around policy provisions on LSC in the system currently, and what can be and what is working, what is not working. For example, the NEP talks about Nishtha trainings, it talks about the task force. So are some of these things actually being done? Is there a concrete movement towards integrating LSC within the overall education system? What are the budgetary provisions? We've spoken a lot about budget, and I also want to point out here that a lot of these thematic areas we are assessing at all levels of the education system. So at the state level, where there are different departments that are looking at budget, primary education, secondary education, we're essentially looking at classes 6 to 12, or the departments that look at curriculum. So and then at the district level, district and block level, and the HOS level, which is the heads of schools, and also SMC level, because SMC members are also critical stakeholders when you talk about the idea of a life skills curriculum being integrated within the education system. So the self-assessment scorecard will enable the state government to be able to assess their preparedness in various thematic areas, whether it is policy provisions, whether it is teacher preparedness and readiness, what is their level of knowledge, where are the gaps, what kind of capacity building exercises do we need to do, in terms of curriculum. Does the curriculum already exist? If so, how is it being really currently implemented, or what is the plan? Would the government prefer the integration of the life skills education curriculum as part of the subjects, or to be taught as a separate subject? So this is overall the self-assessment scorecard, which has been developed for the systems assessment through the process of the formative research. So like other people also mentioned, government has been a critical stakeholder. We have constantly been in touch. Right now, the scorecard is being validated or piloted in 5 districts in each state, in Maharashtra, Mizoram, Uttarakhand, and Rajasthan. And once we have the findings, we'll take it back to the government to understand, where they think things can be improved. Also, our scorecard also includes like a feedback form which talks about how relevant is it. And another thing that came up in the formative research was this critical need for interdepartmental coordination and shared decision making. So in different government education departments, while some program might be going on life skills, or another department might think that there's a need for relevant curriculum, the departments don't necessarily have touch points, or do they have touch points to be able to discuss these issues. So that is on the systems assessment. For the teachers, how do we assess teachers' own level of preparedness, readiness to be able to really implement life skills education? Like Ravi had said in its keynote address, essentially government is the only agency that can do last mile delivery, right? So the education system is the one that needs to have the tools, the resources to be able to elevate the level of any thematic area. And in this case, we're talking about life skills education. So for teachers assessment, we looked at the literature extensively, looked at the scales that have been previously used, and we developed a quantitative survey tool, which was then validated in 2 districts in each of the 4 states. So as part of the validation study, we also conducted focus group discussions with teachers in these 2 districts for every state, and their inputs were very, very valuable. So you get a sense of that the tool is built on the right direction, in the right direction, because the teachers are talking about, while they have an idea of life skills education but not really sure what really is it value education, is it moral education. There are some trainings that have happened but not exclusively on life skills. What are the requirements for capacity building going forward? So the feedback from the findings from the focus group discussion and the validation study then fed into the development of the semi-final tool, which is now being again piloted in the 5 districts of each of the 4 states. So we are looking at the survey with about 1,000 teachers across the 4 states. And just to sort of loop this back in, and I will talk about how we are engaging with government subsequently in the next section. But the idea is that eventually, when the tools are finalized, also I just want to mention that the tools have been developed contextually, keeping in mind the local language. So in Uttarakhand and Rajasthan, they're in Hindi. In Mizoram and Maharashtra, they are in Mizo and Marathi respectively. So the idea is that ultimately, when the tools are finalized, we will take it back to the government, and the governments can use that to be really able to assess their own readiness, preparedness to uptake and upscale life skills education embedded within the education system. And those tools should be available in public domain for other governments also to do the same. Also, just furthering overall the agenda of the NEP 2020 as well in this regard. I will stop here. Apologies if I took longer than I was assigned.
No, thank you. Thank you, Aditi. That was a very well-rounded of response in terms of how you're engaging the system at each level and what you're exactly doing. Because we are running short of time, what I'm going to do is just sort of combine our last 2 questions. In a way, the last question has almost been answered by all of you. So I think we focus on this very important question on challenges and barriers and enablers, right? What is it? What are things that work when you are sort of trying to use evidence and work with the government? What is it that's helpful, and what are some of the barriers? We'll go through each one of you, and then I think open the floor to the audience and see if they have any questions. So Aditi, we'll begin with you. If you could speak a little bit about what's been very helpful and what are some of the barriers
Thank you, Sapna. So, like I've been saying, the government, the state education system, and the entire government is a critical stakeholder, but not just a critical stakeholder, an active collaborator. So, the Life Skills Collaborative has been very conscious in making concentrated, consistent efforts to engage the government from the very inception of the program. So, to give you an example, in terms of when we developed the first round of the teachers assessment tool, we had state level workshops where we had government stakeholders, teachers, lecturers, other people from different departments come together and look at the tool and see whether the language is working or not, whether it is contextual or not. In some and in different states, we had different responses. So this was a very critical exercise to ensure that the government also feels that, this is not somebody external coming in and just, conducting a survey or conducting research with your officials and just bringing out some set of tools or public goods, but actually, using the knowledge, the information, the data that the government already has to be able to, feed it into the assessment tool development process. Similarly, for like I was talking about the key informant interviews that we conducted as part of the formative research study for developing the systems assessment scorecard. There too, when we conducted the KIIs, after what the findings showed from the KIIs, we took it back to the government. We've been repeatedly sharing, making conscious efforts to have this periodic check-in with governments at the various stages of the process, so that they are not only part of the process, they are equal stakeholders in the process to a large extent. And it's very useful to be able to do that. And also, so in terms of the challenges, I think it is very important that when you bring government on board as a critical partner, stakeholder, when you're looking at it as a to and fro relationship, not just somebody who's just a bystander, it is very important to really listen to their needs. What is it that they really require? What are they looking for? So for example, in our KIIs, talking to the teachers, everybody spoke in detail about NAP, in detail about how the pandemic has really exacerbated the need for life skills education, which goes beyond academic teaching. And so how do you weave that into your tools? That is one. The other thing is, there are obviously going to be challenges in terms of timelines. You plan a certain workshop, but then something else comes up. I mean, obviously we have all been dealing with COVID. In some cases it's the school closure, some cases it's the exams. So those kind of challenges are always there, which if you're in constant communication and there's open transparency, you should be able to navigate. The other part of it is that, they have to be also, the partnership has to be tailored to the specific needs of the government that you're working in. So for example, in Rajasthan and Uttarakhand, the approach is slightly different. In Maharashtra and Mizoram, it's slightly different. Like Maharashtra government engagement partners that we have, and then the way we work with the government, they want us to sort of, meet more frequently, for example, just to sort of keep giving them updates as to what is happening, what are the findings at this stage. So we mitigate that. We sort of figure out ways to sort of ensure that we are giving back to the government what they're asking for, and they don't see it as an external agency coming in and sort of leveraging their processes, but more of a partnership where they're equally participative and collaborative. I hope I've sort of answered your question.
Thank you. Thank you so much, Aditi. Sneha, would you like to reflect? Sneha Sharma, would you like to reflect a little bit on some of the challenges and barriers and add on to what Aditi has been talking about?
Yes. So, I mean, a lot of the challenges that Aditi spoke about, and also a lot of the things that enabled, I think, even my reflection sort of would be very similar to that. So in terms of the challenges that we faced, and here I have to say that the challenges for both COVID tracker and the COVID-19 informal women workers rebuild project that we are doing is sort of similar in terms of, how do you establish that there is a need to include gender in policy making, or include gender in systems around, say, health reporting. So just being able to establish that need, I think that was the struggle, because a lot of times, and as Aditi also said, that we need to tailor our communications and tailor our need from the systems to be able to respond. So how do we address that? So one of the key things was that, and this was one of the findings from our COVID tracker project, where we did KIIs with stakeholders involved in development of vaccine. So one of the key findings was that gender and the health officials, they have a very separate kind of a language. And that the language that gender experts would use is not very suitable for getting that into an implementable language for policymakers. So that was one of the key things that stood out from that project. But that is also very true for our engagement with informal workers, where we were having a very large, we were having a workshop with a lot of experts involved in trade unions and a lot of experts involved in working with women and the economic empowerment. And they spoke about how the research a lot of times is not able to actually address what is required for a policymaker, or what is required for a trade union, or what is required for a local level government to be able to implement to include gendered considerations. So one of the key things that has been an enabler for us is to be able to use our findings and tailor it according to the need of the level of the advocacy level that we are at. So we have been, and this is a constant thing that we have been doing now. So we are, we are developing policy briefs, or we are developing policy messages and recommendations. And all of these recommendations look very different for, say, a municipal level a municipal level organization or a local governance system. So the recommendations for working with informal workers and addressing their needs at a local level system is very different from recommendations for a global policy network. So that has been one of the key enablers for us. And other than that, and I know I think Aditi also resonated, spoke about that we were working, and both these projects are being implemented during and being researched during the COVID context. COVID was such a crazy time for everyone. And it was a struggle to be able to engage with policymakers or even any kind of stakeholders that were involved in making COVID-related policy decisions. And that is because they have such competing priorities that it really gets, it is a very big struggle to be able to engage that. So having constant engagement with them, even in very small, it doesn't have to be long-term engagement. It doesn't have to be 1-hour interviews, but just having constant engagement through emails, through sharing of our reports has been very helpful to be able to establish that relationship with them, and then getting their buy-ins when we are looking for a very detailed engagement with them. So that was another thing that we did. So I think that's what I would talk about in terms of the struggles and the challenges and the learnings that we had from working with stakeholders.
Yeah. Thank you, Sneha. Thank you. Sneha Pillai, would you like to add on to that in terms of challenges and in terms of some enablers?
Absolutely. I think at the start itself, I'd like to echo the point that Aditi was making, right, about having the government be like an important collaborator in this process itself. So that's something that even, at TQH, we have actually been seeing quite a bit, especially in the policy research ecosystem. We often see that research organizations, they come up with like really critically important policy research. But sometimes there are these, that need to basically take that research into its next logical conclusion, which is to see where the research findings can actually feed into policy making. Sometimes that bridge, it's not just, that gap remains. And similarly, there's also a gap from the government's end where they are not actively pursuing these research that comes out unless it's been commissioned by them. So in that sense, at TQH also, for most of the work that we do in policy, we try to first see if we can have some sort of a listening exercise, which is to if you're working on a particular policy issue, reach out to the respective government stakeholders, try and understand what is their policy priorities, right? Where is it that they are seeing in terms of policy, some kind of a sticky challenge, and see where we can come up in terms of research and just making sure that wherever we are putting in our efforts, it's actually leading to some positive policy change. So in that sense, I feel like one of the biggest enablers is to just keep the government stakeholders involved from the beginning itself, and to, basically take into consideration what their policy priorities are. And secondly, in terms of challenges, I think specifically for the ICRW study, again, to echo something that even Sneha was talking about is, all of this was based in a COVID context. So for one, there is, I think that's something that most researchers can also allude to, is that there is a data gap when it comes to what is available from the government. Like for most of the center schemes, centrally led schemes, while we could find MIS databases, while we could get some, beneficiary data from the schemes, like websites, for the state level schemes, those were most often missing. So we had actually no idea how the budget was being used, who was it actually reaching out to. For some of the big ticket schemes, again from the central level, we also had Lok Sabha, Rajya Sabha responses to look into for like data. So those were super helpful. Another thing that was really helpful in terms of just sourcing data was also to look at some of these third-party surveys, right? The ones that ActionAid and Azim Premji Foundation and the others had also done during COVID. These were super helpful. But also at the same time, we had to be cognizant of the fact that these surveys themselves had some limitations, because they were also being done during the COVID context. So most of them were telephonic surveys. From our key informant interviews, we were hearing about the instances where people didn't even have enough financial resources to basically recharge their phones. So then again, what Dr. Verma was saying about reaching out to that last person who's on that pipeline of the government welfare, they often get missed out because, they are not that easily reachable. So these are gaps that will continue to exist until and unless, the government sort of steps in with sharing like data, and most importantly, sharing gender disaggregated data. So in that sense, I'm really happy to hear about the work that Sneha Sharma and ICRW has been doing in terms of like really advocating for such efforts to be made, in terms of like making sure that, we have gender disaggregated data available.
Thank you, Sneha. Dalia, over to you, and then Nesar. We have exactly 2 minutes, 2 to 3 minutes.
Okay, yeah. I think I probably will not be repeating what the other panelists has discussed. So with regard to this project, one of the biggest challenge where we faced was the issues which we are discussing, and with whom we are engaging, and what space we are engaging, and through who are leading it. So these all are critical components for us, because we are working with the adolescent boys and delivering the issue of gender-based violence and masculinity, and a lot of norm issues, and talking through teachers in the school setting. That was the biggest challenge we faced, and it took a lot of effort to convince the education system about the importance of the program and talking on this issue at this particular age. So most of the things which reflect was, is it not too early to discuss with boys on this issue? So that is one of the challenge to engage with government on these issues. Another term which comes, of course, like everyone said, the COVID and the time. So especially when we work with the school system and engaging, the engagement is through teachers and with the adolescent boys, the prolonged closure of the schools, that really created a vacuum in between when we just moved. And that is also the crucial part of the project, when we just initiated the program intervention in the schools, and the students got 2 or 3 sessions on this issue, and this gives a very long gap with all of our efforts to engage them with the limitations of internet access and the issues with the online platforms. We are not able to engage with the teachers, but it also provides us an opportunity to how to explore the technology and in this type of situation, how better we should be prepared in future. So we were able to engage with the teachers. The other thing which happened is after the opening of the schools, the priorities of the schools really changed, and they're more focusing on how to retain the children in the school dropout, how to address it. And it of course created an additional burden of the teachers to run the program simultaneously. And I really would say the effort of the program staff really helped to keep the momentum, and the teachers were also really into it. So these are some of the challenges. It's more than the challenges, I feel. These are some of the learnings, and we should look at how to move ahead in this type of situation, especially when we work on the gender and masculinity issues at the school setting. These are some of the thoughts.
Thank you, Dalia. Nesar, over to you.
Yeah. So the challenges have been talked about a lot. So, the government many times is not willing to share data. There were challenges of COVID times, which we all faced. Government will share data, which is not necessarily in the format which the way it speaks much. So there is data, but it is not speaking much. So these are the challenges, and the governments are responsive to it, but they are very slow also. For example, you must have heard of this Jan Suchna portal of Rajasthan, which was which was celebrated in a way about a big milestone in transparency. So governments do respond to also when they are engaged with in a positive manner, telling them the benefits of sharing this information. But still in budget front, these challenges remain. For example, the gender budget statement of Rajasthan or child budget statement of Rajasthan is not very informing. I mean, you would have a look at it and then you don't know what to do with it unless you are a budget study center. It is your job to look into it, decipher it, understand it. Otherwise, it is not very informing to the lay persons, so general population. So these are challenges. But then I would like to talk a little bit about using these analysis. And as I said in beginning, we try to share these findings with the strategic constituencies, like elected representatives, like media, like civil society organizations. And then these civil society organizations, the elected representatives, the media, they use it, the way they feel is more effective. So this is also one way of utilizing your analysis, sharing it with the strategic partners who are going to use it in that way. Then when we talked about methods, one thing is this comparative things, like this COVID tracker information which Sneha was talking about. We did a study on responses to the COVID by different states, and we shared some of it through UNICEF with the state government, and other organizations and other people were also asking. And we also said in that study that many states have come out with some kind of employment guarantee in urban areas, and Rajasthan needs to do that because the unemployment figures are extremely high in Rajasthan. So in this budget, Rajasthan government announced an urban employment guarantee scheme, there will always be a question on how can we say that it is based on this study or that demand or this demand. But I would say that it's cumulative demand of the civil society organizations which has worked in this case. Everybody was talking about it, everybody was wanting it. So these are some of the ways of using this data. Not necessarily we're working directly with the government. Working directly with the government is very important, and obviously the government is the most important stakeholder. I mean, there is no need to make them feel that. They feel that, they know they know that they are the most powerful person sitting at this table. So you don't need to make them feel, they know it already. So obviously that, but then if the same voice is coming from various quarters, various corners, that makes sense to them, and they listen to that. So these are some of the reflections I had in the last question, to the last two questions.
Thank you. Thank you so much. Unfortunately, we've run out of time, so we do not have time for audience questions. But it's my request to everyone who's attending the panel to please write to us if you have any specific questions. I'd like to quickly wrap up today's webinar by just pulling together some of the main things that came out from different panelists. I think different panelists spoke firstly about the purpose of the research or the evidence that you're doing, and how you're involving the government. So is your purpose system strengthening? Are you hoping to strengthen existing government systems for a particular purpose, right? That's one. Second, are you looking at making it more accountable, the government? Are you looking at transparency? Are you looking at addressing some needs that the government itself is articulating? Or are you looking at making sure that government and how it operates, its schemes, policies, its budgets are responsive to the realities on the ground, right? Different purposes, different objectives of using research and evidence to work with the government. I think the second important thing that all panelists touched upon is how do you involve governments in this process? Is your objective critical? Are you coming as an external agency that is trying to scare the government off? Or are you coming as someone who's working in the spirit of collaboration? It's working in the spirit of helping the government reach its goal of equity and inclusion in a manner that is beyond numbers. You know, it's not just about being equitable in terms of numbers. It's about being equitable and inclusive in terms of the spirit, and in terms of actually ensuring that the different needs of people are covered. And I think the third most important thing that all panelists mentioned were around how do you present this data? Is it usable data? What language are you using in the data? How is it something that can be easily used, easily understood? Nesar spoke very nicely about how most of us don't understand budgets. So how do you break it down, right? How is it in a form? How is it in a format that is useful to all parties involved? So I think thank you so much, everyone, for touching upon various points. And it's so interesting that these are projects that are working on different thematic issues, but all have common linkages in terms of how you're working with the government, how you're using the government itself to give you that evidence, and how you're also bringing evidence from outside to strengthen the work of the government. So thank you so much, everyone. It's been an absolute pleasure. And thank you to the audience for joining in.